Since the start of Russia's full-scale invasion of Ukraine in 2022, the appointments, dismissals, reshuffles, and demotions carried out by Russian dictator Vladimir Putin have been closely analyzed by the West, including the United States. The latest subject of this speculation is Russian Foreign Minister Sergey Lavrov. Ilan Berman, senior vice president of the American Foreign Policy Council in Washington and an expert on regional security in the Middle East, Central Asia and Russia, explained in his article for Forbes why the Russian diplomat could have fallen out of favor with Putin. According to him, one important event led to this. Berman recalled that Lavrov is a staunch supporter of the Putin regime. For many years, he carried out the Russian dictator's orders and promoted his ideology beyond Russia's borders. However, in recent days, Lavrov has been absent from a number of high-profile events. For example, the diplomat was absent from the Russian Security Council meeting on November the 5th, allegedly by mutual agreement. Berman also noted that Lavrov has been excluded from the Russian delegation to the upcoming G20 summit in South Africa, scheduled for late November. In his place, the Russian team will be led by a much less influential official, Deputy Chief of Staff of the Presidential Administration, Maxim Oreshkin. The expert emphasized that the Kremlin denies that Lavrov has fallen out of favor with Putin and could lose his position. Putin's press secretary Dmitry Peskov stated that there is not a grain of truth in these reports, assuring everyone that the diplomat will remain foreign minister. Berman added that Lavrov failed to negotiate with the Trump administration following the August summit between the American leader and Putin in Alaska. This led to the cancellation of the two leaders' planned meeting in Budapest, which was supposed to take place in Hungary. This jeopardized Putin's strategy of keeping the United States out of his war against Ukraine. The expert noted that the Kremlin is well aware that if the Trump administration loses patience with Russia and supports European efforts to strengthen Ukraine, the results could be disastrous for Moscow. He believes this could lead to a surge in American military aid to Kiev. Berman also noted that the United States has become more active in cooperating with its allies in Europe, especially those located close to Russia and trying to protect themselves from potential future aggression from Moscow. The expert emphasized that preventing these scenarios from unfolding is the Russian foreign minister's top priority. However, it is becoming increasingly clear that he is failing to fulfill this task. Earlier, Russian Foreign Minister Sergey Lavrov stated his readiness to meet with U.S. Secretary of State Marco Rubio. However, he immediately assured that the Kremlin will not abandon its fundamental conditions for ending the war against Ukraine. He also said that he regularly speaks by phone with the American official. Lavrov also stated that the agreements reached between Russian President Vladimir Putin and U.S. President Donald Trump on August the 15th in Alaska were based on demands made by the Russian dictator in June 2024 and the ideas of U.S. Special Representative Steve Witkoff.
The deputy spokesperson for the Secretary General, Farhan Haq, briefed reporters on the situation in Gaza and in Sudan on Monday. Over the weekend, our teams reported shelling and Navy fire in different parts of Gaza, Haq said. According to Associated Press, the Israeli army attacks in Gaza took place weeks into a fragile ceasefire. In Sudan, the RSF capture of the key city of El Fasher left hundreds dead and forced tens of thousands to flee to overcrowded camps to escape reported atrocities by the paramilitary force, according to aid groups and UN officials. The IOM said nearly 92,000 people have left El Fasher and surrounding villages. Following the Rapid Support Forces takeover of the city on October 26, clashes continue to be reported along key access routes, trapping civilians and cutting off aid, Haq told reporters. The war between the RSF and the military began in 2023, when tensions erupted between the two former allies that were meant to oversee a democratic transition after a 2019 uprising. The fighting has killed at least 40,000 people, according to the World Health Organization, and displaced 12 million. However, aid groups say the true death toll could be many times higher. Once again, we call for an immediate cessation of hostilities, the protection of civilians and humanitarian workers, an end to attacks on hospitals and civilian infrastructure, and safe, unhindered access for aid to reach those in need across Sudan, Hack said.
Turning to Gaza, the Office for the Coordination of Humanitarian Affairs says that 1 month into the ceasefire, efforts to ramp up aid are still being held back by red tape, ongoing bans on key humanitarian partners, too few crossings and routes, and insecurity that persists despite the ceasefire. Over the weekend, our teams reported shelling and Navy fire in different parts of Gaza, though at much lower levels than before the ceasefire. In some areas, our teams still have to coordinate every movement in advance with Israeli authorities. Yesterday, we made 8 coordination attempts. Only 2 were fully facilitated and 4 were impeded on the ground, including 1 that was delayed for 10 hours before the team finally received a green light to move. Despite the challenges, the UN and our partners are seizing every opportunity to expand operations. Yesterday, UN agencies kicked off the catch-up campaign for routine immunization, nutrition, and growth monitoring, which we mentioned last week. UNICEF, the UN Relief and Works Agency, and the World Health Organization are carrying out the campaign with partners in collaboration with the Ministry of Health. The campaign focuses on children who missed earlier vaccination campaigns and aims to reach 44,000 children overall. Today, WHO reported that Al-Khair Hospital in Khan Yunis resumed operations last week after being forced out of service following attacks in February 2024. The agency supported its rehabilitation by restoring water, sanitation, power, and structural systems, and providing essential medical equipment and medicines. WHO also set up a new 20-bed nutrition stabilization center at the hospital to treat children with acute and severe malnutrition. This brings the total across Gaza to 7 such centers, with 70 inpatient beds in all. Between Wednesday and Friday, our humanitarian partners provided mental health and psychosocial support services to 1,500 children and 500 caregivers in different locations across the south. They received help with emotional expression and stress reduction, with messaging on the prevention of child abuse. Over the weekend, our humanitarian partners distributed nearly 40,000 winter clothing kits and pairs of shoes to children under 10. The UN and our partners are also distributing blankets to hospitals and other locations, including nearly 50,000 blankets between Wednesday and Saturday alone. Since the ceasefire over the past month, our humanitarian partners have been providing water trucking services through 2,000 locations across the Gaza Strip. They've also distributed 15,000 hygiene kits and restored some domestic water supply in the Zaytun neighborhood of Gaza City by repairing a critical water line in the area. Moving to Sudan, our humanitarian colleagues warn that the crisis in North Darfur state is deepening as violence spreads beyond the state capital, El Fasher. Following the Rapid Support Forces takeover of the city on October 26th, clashes continue to be reported along key access routes, trapping civilians and cutting off aid. Since that date, nearly 89,000 people have fled Al Fasher and nearby villages, according to the International Organization for Migration. Many have sought refuge in the localities of Tawala, Melit, and Saraf Umrah, while others have traveled to Daba in northern state. In Tawala and Daba, we and our partners are providing food, clean water, sanitation, healthcare, and psychosocial support, among other essential aid, but needs far exceed the available resources.